I guess it's season 3. Grab your piece of paper and let's. Hello and welcome to the Bazooka. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at 10 OSCE stations in one clinical course. This is indeed season 3, episode 1, internal medicine. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications of such videos every time I post. Drop a like, drop a comment, and let's go. Remember that this presentation may actually contain some graphical images, so viewer discretion is greatly advised. And also, these images are meant for teaching purposes and not as a means of diagnosis. If you do see or actually feel that you may have one of these conditions, please seek medical advice and medical attention. Beginning with our station 1, study the image and answer the questions that follow. Remember the drill to this series. You may pause the video at any point. You may even pause the video right now before I finish reading the question to give you time, because sometimes I'm very unpredictable and I may actually change the slide and give you the answer very quickly before you actually even have time to think about it. So what is shown in the image and what are the two variants? List 4 causes. So you may pause the video right now, but here comes the answer. So this is obviously, you notice this bluish discoloration of the fingers. This is what we refer to as peripheral cyanosis. This is one of two variants. You may have central cyanosis where you get bluish discoloration of the tongue. You may also have peripheral cyanosis, which is what is depicted in the picture. Certain conditions like Raynaud's syndrome, where you have this narrowing for some reason of the blood vessels, especially those going to the digits. And you may have conditions like heart failure, hypovolemic shock, congenital heart disease, as well as hypothermia. Moving on to station 2, study the image and answer the questions that follow. What is shown in the image? State 2 common causative agents. State 1 drug used in the management of this condition. So you may pause the video right now. I know you've never seen this. If you have and you've seen it in the Bazooka, well and good. If you haven't seen it in the Ultimate Bazooka and you don't know what the Ultimate Bazooka is actually, then comment in the section below. Don't forget to drop a like and comment what is the Ultimate Bazooka, and we shall send you a copy. I think you're pretty late to the party at this point. So here comes the answer. So this is obviously onychomycosis. This is discoloration, thickening, and even separation from the nail bed of the nail. Then, of course, this is obviously caused by dermatophytes. 70% of the cases are caused by Trichophyton rubrum. Then the 20% are caused by this other species, which I shall not dare to pronounce. You may pronounce it and actually learn it yourself as long as you can spell it in your exam. Then remember that this may actually also be caused by other fungal elements like non-dermatophytic fungi. Even molds can cause this, but these are the two most common causes. And most commonly, onychomycosis is as a result of dermatophytes. Then state 1 drug used in the management of the condition. Terbinafine may be used, or even itraconazole, but I've seen terbinafine being more commonly used. Then station 3, describe the lesion. What is the most likely diagnosis? List 3 musculoskeletal features. You may actually pause the video at this point. Of course, this is one of those things where you either know it or you don't. So here comes the answer. This is obviously characteristic, a butterfly malar rash. And this is seen in SLE, systemic lupus erythematosus. Remember, do not write SLE, write your diagnosis in full. Do not write FBC. What is FBC? Write full blood count. And of course, 3 musculoskeletal features include things like arthritis, which may be non-erosive polyarthritis, tenosynovitis, even myositis. You may even have some arthralgias, which are joint pains, even myalgias, which are muscle aches. Station 4, which is of course another new question that you may have not seen, or another new station that you may not have seen in the Ultimate Bazooka or in the previous Bazooka episodes. But of course, these are only to prepare you for your exams and cover every single base. You may be surprised. Some of these images may pop up on one or two of your exams. Thank me later by subscribing to the channel. Wink, wink. So I know. Bad joke. So describe the abnormality in the patient, list 3 differentials. What investigations would you order for? So here comes the answer. So obviously you can see that there's this accentuation of the thoracic region. This is known as a hunchback. In scientific terms, it's referred to as kyphosis, of course, affecting the thoracic region. Then notice how there is also a barrel-shaped chest. So there is an increase in the antero-posterior diameter. This is often seen in patients that have chronic obstructive pulmonary disorders, like emphysema to be specific, where you have loss of elasticity of the alveoli and they permanently dilate. And this is obviously seen in patients that smoke. It's also seen in patients that have a condition that's known as alpha-1 antitrypsin deficiency. Then they may also see this in asthma. Remember that asthma isn't considered as a COPD because asthma largely is reversible. There are some chronic changes though in asthma, but we're not going to go into details of that. You may also see this in ankylosing spondylitis, and the investigations that you would order for include a chest x-ray, sputum analysis, and ECG in view of cor pulmonale. Recall that cor pulmonale is right-sided heart failure that is often caused by a pulmonary pathology. You may also do some arterial blood gases. Remember, do not write abbreviations, write everything in full. Station 5, and we're indeed halfway, so if you're enjoying this video, drop a like. Do not forget, study the investigation shown and answer the question that follow. Describe the abnormalities shown on the x-ray, list 4 differentials. So here's the x-ray, scream the answers at your screen, pause the video if you may, but here comes the answer. So as we can see here, you have this total opacification of the left hemithorax and obliteration of the costodiaphragmatic, even to the costophrenic angles, then, or costocardiac and costophrenic rather. Then even the diaphragm, we can't really make it out on this side. Then you also have shift of the trachea to the left side, to the affected side. This is most likely consistent with the lung collapse. Recall that you would differentiate this from a massive pleural effusion by the direction where the mediastinum and the trachea actually shift to. Remember that in a pleural effusion, they will shift to the opposite side or to the normal side, whilst in the lung collapse, they would actually be pulled to the affected side. It may be seen in conditions like tuberculosis, pleural effusions, pneumonias, and bronchogenic carcinomas. Moving on to station 6, study the image and answer the questions that follow. Describe what you see. Mention 5 related causes. So you may pause the video right now, and here comes the answer. So recall that this is global distension of the abdomen with some flank fullness. If you also noted the everted umbilicus as well as this dilated superficial veins, then you're indeed on the right track. This is most commonly associated with liver cirrhosis and chronic liver disease, but it may be seen in other conditions like heart failure, peritoneal carcinomatosis, nephrotic syndromes, and even pancreatitis. Moving on to station 7, study the image and answer the questions that follow. Describe the lesion. What is your diagnosis? State the causative agent. What are the variants? This is supposed to be variants, not variant of the condition. So here are the 2 images. They are pretty much fresh from the bank and fresh from Lord knows where. I shall not disclose my source. And here comes the answer. So as you can see, these are dark purple, we'll just call them brownish. This looks like a patch. This looks like a papule. This may be a plaque. This may be a patch or even a plaque. Unless you palpate it, you can't really know. This looks like a papule. Of course, this is very, very consistent with Kaposi sarcoma, and it's most often associated with human herpes virus 8. And the 4 types include the classic or sporadic type, the African cutaneous, which is also known as the endemic, the AIDS associated, which is also known as the epidemic, and the iatrogenic type or the immunosuppressive associated type. Moving on to station 8, study the image shown and answer the questions that follow. Describe the findings on the x-ray. What is your diagnosis? What are the principles of management? So here's the x-ray. We've tackled a lot of x-rays in the past episodes, and I'm sure you're now an expert at this. So you probably should get this correct. If there's one station where you get at least 1 out of 10 stations, I think this is the one. So here comes the answer. So you have this homogeneous opacity of the right upper lobe or the right upper zones of the lungs. Of course, this may be limited by what we make out to be the horizontal fissure. Then this is consistent with a lobar pneumonia. So what are we going to do for this patient? Admit this patient, investigate them adequately, Antibiotics, broad spectrum. Remember, we could use penicillins as a drug of choice. We could also use cephalosporins, third generation cephalosporins. Supportive management, which is obviously going to be including oxygen therapy, intravenous fluids, adequate nutrition, and even chest physiotherapy. Station 9. Study the image and answer the questions that follow. Describe the lesion. What conditions are associated with the pathology shown on the image? What is the most likely diagnosis? And outline the management. You may pause the video at this point, but here comes the answer. So as you can see, we have this whitish patches on the palate. This is obviously associated with conditions that are going to be causing immunosuppression, as seen in conditions like HIV and AIDS, as seen in diabetes mellitus, as seen in cancers, and even in patients that are actually taking immunosuppressive therapy. The oral candidiasis or oral thrush is also seen in infants. In adults, how we treat it, we want to manage and address the underlying cause. So if it's HIV, treat the HIV. If it's diabetes, treat the diabetes. If it's cancer, address the cancer. Then of course, we can use some oral antifungal drugs like fluconazole. Moving on to the last and indeed final station, study the image and answer the questions that follow. Describe the lesions, list 4 differentials. So the lesion is depicted on the picture. You may pause the video right now. And here comes the answer. So this is obviously a small linear splinter hemorrhage in the subungual area. This is supposed to be there on the left thumb, which is of course parallel to the long axis of the nail. And this may be seen in infective endocarditis, which I suspect is what this patient had, vasculitis, nail psoriasis, rheumatoid arthritis. I don't know why nail psoriasis is repeated twice, maybe for emphasis, and of course lupus. So this was your season 3, episode 1 station of the Bazooka. If you really enjoyed, please drop a like, drop a comment in the section below, share this to someone who's having exams and tell them that it is indeed exam week on the channel. God bless to Zambia and beyond. My name is Dr. Moses Kazevu. Until next time, bye-bye.